Yes, okay, that's wonderful. Perfect. Well, thank you everyone for being with us this morning. I know the weather's not great, but I think this is a great opportunity for the coalition to meet with Senator Boulton. And I'm very excited as the co-chair of the Children's Policy Coalition to welcome you, Senator Boulton, to our very first single candidate forum of the primary season in 2018. So, and as we all know, children's health, education, safety, and general well-being should be a top priority. And to ensure that Iowa's children have what they need to thrive, the Children's Policy Coalition has invited candidates of both parties in the gubernatorial race to discuss with us the challenges facing Iowa's kids and families. The coalition is a group of right about 30 organizations committed to raising kids' issues during both state and federal elections. We know that the governor's race that's very highly contested, so we thought it was important to talk with all of the candidates this year. And the coalition does not endorse candidates or score them in any way, but rather we just try to educate voters and lawmakers and candidates for elected office on these urgent issues and encourage candidates to speak out on your own platforms about your policy agenda for children so that voters feel confident when they go to vote on election day that they can choose the person that they feel will best represent kids and families in Iowa. So on that note, I just want to note that we really hope today can be a dialogue and that everyone feels comfortable learning from each other. And if you, Senator Boulton, have any questions for our experts in the room, feel free to ask them. We'll do our best to talk about the topics we've prepared for today. Okay. So just want to take a moment and let everyone introduce themselves and then hear a little bit from you and your campaign. So my name is Jill Applegate, and I am the program manager for Every Child Matters in Iowa. And
I am Ann Disher, and I'm the executive director of the Child and Family Policy Center.
I'm Ashley Oddie. I'm with the Iowa Association for the Education of Young Children. I'm Laura Patton. I'm with Child Care Resource and Referral at Orchard Place.
I'm Charlie Bruner. I'm the former of a lot of things.
Yes.
State senator with the Child and Family Policy Center. I say I'm a freelance child policy agitator right now.
Good.
Brittany Samuelson with the Iowa After School Alliance. Elena Shelby with Community Action and Iowa Head Start.
Stephen Dykstra with Child and Family Policy Center.
Denise Rathman, National Association of Social Workers, Iowa Chapter.
Mary Nelstrauss, Child and Family Policy Center.
Cheney Yates, Blank Children's Hospital.
E.J. Wallace, Save the Children Action Network.
Julianne Clamby, Nate Boulton's political director.
All right, yeah, you have the floor.
All right. Well, first of all, thank you all for getting together. I've gotten to know most of you through the legislative process, and I appreciate all of you taking so much time to advocate for issues important to children. As we look at our state's future, one of the things I say on the campaign trail over and over again is we have to have a plan for the next 20 years, not just the next 20 months. And we see that over and over again in state government right now. We're planning for the immediate future, but not the long-term future. And when we think about issues that affect children, we're talking about our state's future workforce, our state's future educators, our state's future in a variety of ways. I'm someone who has invested myself in children's issues throughout my career. Many of you maybe don't know this, but I actually sought out to be a high school government and history teacher when I went to Simpson College. I got the coaching endorsement to go with it, so I was serious about teaching social studies in Iowa. Student taught at Indianola High School and did a little bit of substitute teaching during law school. I also currently serve on the Healthy and Well Kids in Iowa board. When we look at some of the frustrations we have in healthcare in Iowa, one of the bright spots is the efficiency of our Hawkeye program. It was, of course, a little troubling to me that in the condition of the state address this year, as CHIP funding was expired and we were within a month of having to inform families that Hawkeye would not be there for them, that in the condition of the state address, Governor Reynolds saw fit to talk about repeal and replace, but did not mention CHIP funding. If you're going to weigh in on healthcare on a federal issue at that moment, CHIP funding was the issue to make sure we took care of for Iowa's children. When we start talking about the other things that we can do, as we look at the shortfalls of Medicaid, as we look at the shortfalls of DHS funding and the lack of adequate caseworkers to handle caseloads for at-risk children, there are several things that are directly related to this budget process that the legislature is going to be engaged in the next week, 2 weeks, 3 weeks. We'll see how it plays out. But we really have to make sure that children's issues are being taken care of as part of that process, because we've seen too much lost. Children's hearing aids last year were a big issue. And when we see things like that pared down further and further, we have to recognize there's a cause and effect problem here. And when the only plan is to deal with the budget shortfall in terms of its effect, not its causes, we're going to continue to see those threats get worse and worse. So I'm probably focusing more on the budget than I should in this conversation right now, but it is top of mind for me right now. I'm on the Appropriations Committee, and we have to get serious about taking care of Iowans. And if we don't do that in the budgeting process, we're not going to see the advances made. So with that, I'm happy to open up for questions or comments, or however you want to hold the discussion.
Yeah, well, I think actually that's a really great place to start is the budget. And Charlie, if you could help me out with this question, that would be wonderful. But I would like to start discussing how, as governor, you plan to budget for Iowa's priorities. And specifically, our question is, what is your plan to tackle tax policy issues to ensure we have a stable and adequate general fund to pay for priorities such as children's health, safety, education, economic security, and development? And I think, Charlie, if you'd like to speak a little bit about the budget process over the last years or so and your knowledge about that.
Well, I think one of the challenges is, as you know, 70% of the state budget goes for kids when you look at K-12 education and early childhood, Medicaid coverage for kids, which is 20% of the Medicaid budget, higher education. Over the last 20 years, those have not kept pace, even with inflation, much less with state revenue growth. And as a result, I think we're in a situation where a lot of the investments that we think should be made are not being made, particularly in the area of young children. And the tax bills that are coming up have the potential of, particularly the Senate version, dramatically reducing.
Present company excluded in that Senate version, of course.
Well, the Senate File 2383, which you opposed,
correct,
have the potential of just really causing 12% cuts pretty immediately across the board.
Yeah.
So I think what Jill's question really is where can we make, a stable budget that's going to be able to sustain and improve funding where you think it's needed.
Yeah, and it is, and it comes back to that cause and effect question, right? We keep dealing with the effects and not the cause, and then you layer in, what the Senate version was $1 billion budget-busting tax bill. I mean, when you talk about our budget, which is $7.2 to $7.5 billion budget, you can't cut $1 billion out of that and say that it's just going to be made up long-term with economic growth. We're talking about 1 out of every $7 missing in state government at a time when we're already seeing mid-year budget cuts play out, when we're already seeing permanent budget cuts to the last fiscal year. Then we saw the rate of the rainy day fund and the emergency transfer that happened last summer rather than calling a legislative special session to deal with these budget issues. And then we started this year with another round of cuts that didn't actually take effect until the last 90 days, basically, of the fiscal year. So you're telling these agencies and departments, in 90 days, you have to find ways to cut what you were told you could budget for. And we still don't have a budget for next year, so you don't know what you can push off into next year's budget and what will be there if you can delay some hiring or other things. So this process is absurd at this point. And we're not going to see a change in this from layering on a tax cut on top of a process that's already unpredictable. I've been advocating for dealing with the root cause of these problems and this uncertainty, and that is a complete overextension on tax credits, exemptions, and giveaways to corporations. It's economic quicksand. Even when it's the most successful, it's building a foundation on quicksand in our economy. Because if all Iowa can be for the long-term economic future is a low-wage, low-tax state, we're not going to have the quality of life that has steered our economy for the long term. When you look back at the things that have brought good employers to Iowa, it's not because we were the cheapest and gave out the most coupons. It's because we had the most educated, skilled, productive workforce in the world. We had a great education system that employers and employees wanted their kids to be a part of. We had good access to quality health care. We have so many inherent advantages in economic development that the states that rely on those giveaways don't have. We don't have a western Nebraska or western Kansas where we have somewhat of a population desert in Iowa. We have a population base that stretches across our state. We have two of the nation's largest rivers as our borders. We have the intersection of 80-35 for moving goods across the nation. We have a great agricultural climate and great topsoil for a base foundation and agricultural productivity to go with economic development. We have cities here that are the rivals of any mid-sized city or even, in fact, large cities in the nation. We have all of those advantages, yet this administration has hinged economic development on trying to be the lowest bidder, as opposed to taking those advantages as economic opportunities. So I think it has to start with the cause, which is starting to pare back all of these giveaways and exemptions. If we had simply targeted, for example, the commercial property tax credit, rather than having our state make it a blanket exemption and have, frankly, the profits padded of some of the largest and most profitable commercial property developments in our state, we're talking about high-rise developments in Des Moines and Cedar Rapids, we could have helped the small businesses. Let's say we capped it at $350,000, $400,000 of value. We helped the small businesses that needed the relief and the assistance to get by, but then we avoid padding the profits of people that didn't lower anybody's rent, that didn't change anything economically for their customers, simply just turned a larger profit. It's the same thing with the the consumables exemption in manufacturing. The component parts in the manufacturing process were exempted from sales tax through a rules change. Well, if it had been a legislative change and we could have capped it and again made it so a small manufacturer who has a narrow profit margin gets through a rough time, we could have structured that so it costs the same thing it was projected to cost, about $20 million. Instead, making it a blanket exemption, we saw the effect of it not costing our state $20 million, but $86 million. That's a major portion of last year's budget shortfall right there. So if you target, if you get strategic about it instead of ham-handed, we avoid a lot of these problems. The fastest growing part of the state's budget are these economic incentives that have been out there that haven't yielded sustainable economic development. And you're not going to address a problem you don't believe exists. We've heard from Governor Reynolds that the cuts to the budget have not affected services, which is simply not true. You cannot cut all funding to a department or an agency and then say it provides the same level of service. You can't lose over 1,000 DHS field workers and say DHS has the same level of child services in our state. And you certainly don't do it by compounding the problem. I mean, after all those mid-year budget cuts, after all those problems developed, this administration had a press conference touting $20 million in new giveaways to Apple, the wealthiest corporation on the face of the planet, for 50 jobs. After the construction is done, it'll be 50 jobs in that Apple development. That's $400,000 a job. They promised 200,000 new jobs when Branstad and Reynolds were running for governor. We cannot afford their 200,000 new jobs at that rate. I mean, that would be every Iowa taxpayer paying $26,000 more in taxes to support that economic development. It's not sustainable, especially when you have announcements like the state ombudsman saying they're not going to respond to, for example, nursing home complaints in person. They're going to do phone checks when they get those calls. That announcement was made, I think, within 10 days of the Apple deal being cut. Those two things are not unrelated. Those are inexorably tied together. And somebody's got to pay for our budget. And unfortunately, it's become the lower wage earners in our state that are still paying their fair share, while we have some of the wealthiest corporations and wealthiest individuals in the state not only failing to pay their fair share, but in some cases we're sending out 6 and 7-figure credits out of state for economic development. So that system just has to be changed, and I think it focuses on starting to sunset, cap, and better target a lot of these corporate tax giveaways, and then get responsible in the budgeting process. Because one of the things that I've complained about on the Appropriations Committee is a lot of these cuts have been to areas that have matching fund components at the federal level. So it's not a $1 cut, sometimes it's a $2 or $3 effective cut to these budgets. And a lot of them are revenue positive things. If you spend $1, for example, in the courts bring in more money than they take out of our budget. Forget the fact that they are a co-equal branch of government and we have a constitutional duty to fund them appropriately. When we underfund the courts, that means we have fewer resources available for drug courts and family courts and other specialty courts that actually help people get through the judicial process faster, and for some of those diversion programs, stay out of our correctional system and remain tax-paying, productive citizens. So those are the things we lose sight of when you make a budget cut for this year that maybe costs us, for that $1 this year, $30 into the future.
Well, I think I'd like to turn to a similar topic, and I'll turn the floor over to Lana Shope of Iowa Community Action Association to talk about family economic security.
Yeah.
Good morning.
Good morning.
We know there are about 15% of our children who are living in poverty today. We know there's generational poverty. We know there's a lot of talk about a 2-gen approach and working holistically with the family to overcome the conditions and causes of poverty. We also know lots of people living in poverty are working, oftentimes more than one job, but we still see the inequality of income becoming larger and larger. So our question is, what actions will you take to reduce multi-generational poverty and ensure that all children have access to equal opportunities for success?
Yeah, we see a lot of disparities in terms of our economy being stable and growing, but far too many people struggling in an economy that is doing well. For example, it ties into our budget process. When we have a 17-year low in unemployment in this state, there's absolutely no reason for us to be raiding the rainy day fund. I mean, those two things should absolutely never happen. But yet we're seeing that now as a systemic problem in Iowa. And it's because the wages aren't growing, particularly for our lowest wage earners. And it does not help that this administration, this legislature actually reached into 5 Iowa counties that actually stood up for our lowest wage earners and raised the minimum wage, and actually took away those wage increases, actually reducing wages for thousands of Iowa workers, people that are working full time, that are just trying to get by, not even get ahead, saw that wage cut. When you have stagnant wage growth, that means we have, again, more budget problems, because that economic base isn't able to support the programs that we need. And when we talk about things like education, going 8 years without seeing their budgets increase to even keep up with inflation, we're not going to address a lot of those inequalities, particularly in rural Iowa, where you see a lot more school consolidation, a lot less access to some of the same opportunities in our urban districts. The kind of secret agency out there, the area education agencies that are often an equalizer for rural Iowa education, they're the ones that can get cut the easiest without that direct impact being seen by people across our state. Well, those are the things that allow those rural Iowans that maybe don't have access to the AP classes and the college credit classes to find access to those things that they are otherwise missing. That's a big deal in terms of the opportunities being there to advance. The other disproportionate impact in our state is to our minority populations. We have a very low unemployment, but that's not true for persons with disabilities, persons of color in our state. I come from a town, Columbus Junction. I talk about it a lot on the campaign trail. But it's a community where I grew up with a very high minority population. While I was there, it was primarily Central America and Mexico. But now that community has seen an influx of Southeast Asian immigrants. We can do some things to support that next generation finding their path forward with quality ELL programming in our schools. By having some of that economic development targeted on immigrant-owned businesses. You look at Columbus Junction's Main Street. There are a lot of immigrant-owned businesses that are open on Main Street that you frankly would see a lot of closed stores if the immigrant community had not come in and decided to forge that new path forward. But the state has not been a very good partner to those businesses. They're doing the best they can with the resources they can, but think about what those communities would look like if they had access to forgivable loans and grants, so their storefronts are attractive, so they have more than just their personal friends and neighbors shopping there, but are getting people from around the state to come into a vibrant small town Main Street. Some of it has to do with housing and economic development. I toured Parkersburg during this campaign. Parkersburg is a small town, not unlike a lot of other small towns in Iowa, but it's seen some pretty good economic growth and new housing. Unfortunately, it took a tornado ripping through that community to get investments in new housing, which then spurred more new housing and spurred more economic growth because people in the Cedar Valley said, well, we like the small town style of life, we like everything about this community, and it's got good attractive housing, and I can see a path forward there. We can end some of that poverty cycle in rural Iowa by making sure that there's adequate housing in those communities. And then, again, in terms of economic development, we need to play to our strengths. And it's not just bringing in a quality brand sticker to put on the side of a building that's recognizable. And it's not just the number of jobs, but the quality of jobs that we can bring in. When we focus on things like value-added agriculture in our mid-sized and small communities, we take those bushels of corn and soybeans and add value to them and have them go through another round of economic progress before they leave our state's borders. I'm talking about things that are very attractive right now in our national economy: biodegradable plastics, more renewable fuels and renewable resources. Those are things that we can do to add value to our corn and beans and create more economic development in economically depressed areas that are looking for that progress. And it's sustainable. We're uniquely positioned to grow in those ways here in Iowa. So those are some things where we see that opportunity in those rural and mid-sized communities that are left behind. And then, when you look at our more urban populations, the things that we can do to serve our urban communities, again, it's not an outlier answer to say education is key. When we see underfunded school systems, we see consolidation in rural Iowa, and we see overcrowded classrooms in more urban settings. Well, in an overcrowded classroom, I'm someone, again, who went through the teacher education program at Simpson College. I will tell you, I don't care how inspirational I am as your high school government and history teacher, if you checked out of the learning process in the second or third grade because you were lost in the crowd and you identified yourself as a dumb kid, we're not going to get you back in middle school or high school. And that's something that we see happen in urban schools. When you see more increases in class sizes, you see those students that have struggled in reading or math, that aren't getting the individualized attention that they need to make up that lost ground, checking out of the education process. It also affects the higher end learners, the ones who are advancing above the rest of the class that now are bored in the classroom because they're not seeing that intellectual stimulation that they need to stay sharp and competitive. So they think they're above the education process. And they find out in middle school or high school that coasting is no longer okay because you're learning a lot of new things that you needed to be engaged in to keep up with. So those are some real threats that I think are there to the long-term economic progress in our state. And again, going back to the original, problem of the tax credits, $20 million that was given to Apple. That $20 million could have funded 260 Main Street Iowa grants. That could have helped real economic development in a lot of our communities that are struggling with economic progress to start seeing the wage growth that we need. And the last thing I'll say on this is we need more Iowans, and we need more Iowans with the skills we need to steer our economic future. We want Iowa to be an attractive place where people want to come to raise their family, where employers want to come to employ that dependable workforce that they need. We need to do it on two ends. It's an education system that delivers from preschool and early education all the way through, apprenticeships and community colleges and independent colleges and our Regents institutions, that whole system that Iowa's always been very proud of succeeding, but also the wages and benefits that attract people to come here. I propose things like paid family leave in the legislature. We could be among the leading states rather than a trailing state on an issue that's growing in bipartisan support that could make us that attractive destination for families. And that helps families stay home with sick kids. It helps families, with the placement of an adoptive child or bringing up a child that's born into the family in those key formative years. It gives that working family the opportunity to support that next generation. So we can do some of those things, but we're not going to do it just by hoping something changes. We have to be intentional about this.
I have one follow-up to this, if it's okay. 25% of the jobs in Iowa pay less than $11 an hour.
Right.
They're jobs we see every day. They're direct care workers, they're child care workers.
Right.
They're people who are working at McDonald's or Burger King or Walmart. There are people who are doing maintenance work and doing services, cleaning rooms in our hospitals. Those jobs, a lot of families rely upon that income, and it's low wage, and it's just not going to be enough. And we still need them.
Right.
So either we have to raise those jobs or improve our earned income tax credit or improve our child tax credit or do something to help those families get by. I mean, obviously we want them to get ahead and have higher employment, but somebody's going to be doing
exactly
jobs.
And that's
where's
the wage growth problem, right? When we see stagnant wage growth, the competition for workers isn't there. So you're not going to see wage growth stretch through all sectors of the economy when we don't see wage growth happening in most of our state. Again, going back to the campaign promise versus the delivery, Branstad and Reynolds touted 25% as an increase in earnings for Iowa families as the goal. Well, here we are in the 8th year, and we haven't seen that. In fact, adjusted for the last 10 years, Iowa has not kept up with the rest of the nation. We're at 1.3% adjusted for inflation wage growth. The rest of the nation was at 1.4%. So we're not even treading water with the rest of the nation. We have a minimum wage that's lower than 5 of our 6 neighboring states. If a low minimum wage was the key to economic progress and development, we should be seeing all of those quality employers coming into Iowa, and not only low unemployment, but great wage growth. It's not working. In fact, it's keeping our wages artificially low. So we have to raise the minimum wage, but we also have to focus on the opportunity for wage growth across employment sectors. Again, you look at actions as opposed to policy promises. Not only did they reduce the minimum wage in 5 Iowa counties, public sector bargaining is another issue that's going to stretch into every single county that's going to affect wages. Because when you have, for example, resident treatment workers and nurses working overtime but not getting paid overtime rate for those overtime hours, they have an effective wage cut there as you factor in health insurance for a teacher. And you tell teachers across this state that when they start their profession, as let's say a 22-year-old graduating from Drake or Iowa State here, when you start your profession, you're going to be earning the highest wage you ever will, because that public sector bargaining bill has baked into it the fact that you'll never see a wage increase that will keep up with inflation for your entire career. The best you can negotiate for is 3% or the cost of living, whichever is lower. So you're telling every teacher starting their career, every social worker starting his or her career, they'll never see a wage increase that keeps up with inflation. And then you layer in the health insurance aspect of that. That means you will not have a voice in your health insurance plan. So as budgets get tight, as the backfill disappears, more and more of the burden goes on to the employee benefit plan. And then you have Lieutenant Governor Reynolds last year was talking about a need for an IPERS task force. And then you have Senate President Charles Snyder, who was on the Appropriations Committee when I was on a talk show here in Des Moines, talking about needing to change IPERS. So now you're going to reduce the retirement security of that same family. And those all have effects on the wage growth that we need. It's going to affect who chooses a lot of these professions. And when you look into rural Iowa, think about all those small businesses, all those family farms that count on public employment to go with that private business or that family farm to make ends meet, to get through the ups and downs with steady wages and quality benefits and a retirement program to invest in. We're not hearing discussions on how to gain back those lost wages and benefits and rights for working families from this administration. I've tried to switch the conversation to finding ways to expand economic security. I worked with State Treasurer Fitzgerald to do Retirement Savings Iowa. Rather than taking away the security of IPERS and public pensions from public employees, why don't we offer a state-managed public retirement system that would work like an IRA, but you don't have to have $5,000 to start it or $10,000 to start it. You can start with $20 from your first paycheck and pay in as much as you want, as long as you want, or as few weeks as you want, but you'll always have access to that public retirement investment program. That's economic security that takes the stress off of that family 20, 30 years down the road, that will be supporting grandma and grandpa at the same time they're supporting their children. You know, that also is important to family incomes. So, you know, it's an approach that you have to have a lot of different angles on, and we're missing all of them right now.
Well, you had touched briefly on early education as well as workforce supports, and so I'd like to transition to talking about childcare and early education.
Right.
So I'll turn it over to you, Laura Patton of Child Care Resource and Referral, and Ashley, feel free to jump in if you'd like as well. And so to talk about childcare as a pressing issue here in Iowa.
Working parents depend on accessible childcare to get to work in the morning and provide income for their families. 80% of brain development in children happen before the age of 3, so a lot happens in that time. Childcare serves as a vital opportunity for early learning, and waiting until pre-kindergarten or preschool is really too late. Effective early care and education is like a 4-legged stool. I thought that was a good analogy. It requires affordability, accessibility, high quality, and supportive workforce. 24% of Iowans live in a child care desert right now, where there's not enough providers or child care available. The cost of center-based care and family care is often out of reach for many families. Sorry, I just lost my spot there for a second. Iowa's providers are also struggling to make ends meet, so trying to attract the workforce to come into this field is difficult with an average annual income of about $20,000. So, and the reimbursement rate doesn't even meet the current market rate. So how will you support affordable childcare and access to programs, promote the importance of quality, and address childcare workforce needs?
Yeah, again, the state needs to be a better partner, but I hate to sound like a broken record, but we have to be able to support effective programs with dollars, and we also have to make sure that we see the wage growth so families can have access to childcare and early childhood education. I mean, those are things that need to happen for every family across our state, but in fact, you're seeing people that are working full-time jobs or full-time plus jobs and staying well below the poverty level. And so that next generation is going to miss out on those educational opportunities early on. And you're right, we can't wait for preschool to get there. You look at some of the things that other states and other countries are doing. There are good examples out there. We just have to have the initiative to take on, the work to get us there. My fear is in this current cycle and this we keep hearing, well, we can't do it this year. We can't take this on this year. We just can't afford new programming. We can't afford new supports. We can't afford initiatives. And that's where I keep talking about the cause and effect issue in our budgeting process and in our priorities. It was extremely frustrating for me in the appropriations process this year when the Senate was pushing through its massive mid-year budget cut bill, and I was critical of it. Senator Garrett said, well, Senator Boulton, what are you going to cut? What are you going to cut to get us through this? And I was frustrated. I said, well, Senator Garrett, I'm glad you asked, because last year you wouldn't take any amendment that I offered on anything. It's good to be a part of the discussion on the solution for once. But the reality is we should not be in a position where we're unable to deliver on these things. We just shouldn't be. We should be in a position where we're talking about how we're expanding things, not retracting. And you can't go through year after year and cycle after cycle of cuts and not identify the problem that's causing that. And it's the uncertainty of our budgeting process that is directly tied to those tax credits and giveaways. And if we can have credit programs that benefit the Apples of the world, why are we not investing in early childhood credits and programs to support the families who actually we need to produce the workforce that every major employer says is our biggest drawback in this state? The sheer number of qualified workers for the future. And again, it not only pays off long term, it does pay off immediate term, because we make it easier for a family to choose to be here, right? We make it an attractive environment for raising your children. So, I mean, we have the immediate payoff and the long-term payoff with these types of investments. When you invest in the corporate giveaways, we have a slight short-term gain, and then when that credit or exemption expires or is taken away, that employer goes on to Kansas or Oklahoma or Mississippi to go see where the next round of credits or coupons will be. And again, that's one sustainable and one is not. And investing in families and children is sustainable.
Yeah, I'd just like to mention too, I think the concern specifically with childcare, I think right now is, we hear a lot of workforce proposals on training and education in rural Iowa, across the state, and childcare is often missing from those proposals, but yet it is a major part of a parent's ability to participate in workforce training as well as keep their job. And
right, and that's what I was saying there, is
yeah.
that makes us an attractive state to relocate to, as well as support the economic development long term.
Absolutely. So I'd like to turn to a similar issue, and I'll ask Brittany Samuelson of the Iowa After School Alliance to talk about access to after school and summer learning.
Thank you. Good morning. So as you probably know, after school programming, before school programming, and summer learning programs are crucial supports for families. It's a crucial work support by offering a safe place for children to go while parents are working. And it's also a crucial learning opportunity and enriching learning opportunity for youth and children to have, especially those who are facing that achievement gap. 75% of Iowa parents support public funding of after-school programs, yet that funding from the state is just not there. There are approximately 145,000 students and youth who are on waiting lists for after-school programs. But so meaning they would be in a program if there was one available for them. So I guess the question is, how would you ensure that all children and youth have access to high quality before school, after school, and summer programming if they want it?
We budget for it.
Yeah.
I mean, it's really inexpensive. I mean, relative to the rest of our state's budget, it's not a major line item to increase the opportunities for kids across our state is not that expensive. And that's, I'm sorry to be flip about it, but it's a frustration that I've had on the Appropriations Committee, where we see dramatic cuts to some really small areas of the budget that really hurt people's lives. I'm thinking of, not just the issues that we're talking about here in terms of after-school programming and things, but, victims of domestic assault and sexual abuse. I mean, what they did to the victims of those things in terms of our state's programming last year. I was on the Budget Systems Appropriation Subcommittee for Justice, and to watch as that part of the budget was just reduced dramatically, saving hundreds of thousands of dollars for our state when we have millions and billions going elsewhere. I mean, it's just so frustrating to see programs that directly impact people's lives that are very affordable in the budgeting process continue to not be supported in favor of, it is frustrating to see Apple get $20 million when we couldn't find a few $100,000 for children, for victims of sexual abuse and assault in our budgeting process. That does have to change. So that's, I don't mean to be too direct and short with the answer, but that really is it. And the benefit that we get from a relatively small investment there, it shouldn't be a hard decision.
Well, we'll switch gears a little bit, and I'll hand the floor to Chena Yeast and Mary Nell if you'd like to contribute to talk about health and well-being.
So appreciate you already talked about the importance of Hawkeye to our continuum
Right.
of healthcare for children in Iowa. So this topic around children's health and well-being packs a lot into one topic. So there's been lots of movement this year on the adult mental health system and making improvements to that system. In Iowa, we truly lack a comprehensive children's mental health system. And when we say that, it means depending on where you live, your ability to access prevention, services, assessment, that all is very different for families across the state. We know that 1 in 5 children in Iowa are struggling with a mental health issue, yet less than 2% of those kids actually access any type of treatment and intervention. Those kids are at risk for attendance issues, dropping out of school, potentially entering the juvenile justice system, becoming homeless, and possibly inflicting self-harm. So it's a crisis that we see for our kids. Additionally, the Medicaid population in Iowa, half our Medicaid population are children, yet we tend to focus on the elderly and disabled population in Medicaid because they're the most expensive. Children, even though they're half of the population, they only are about 20% of the cost of the Medicaid budget. So we tend to just not address that. Our question is, what actions would you take to ensure access to services to address the developmental, emotional, and mental health needs of infants, children, and young adults?
Great question. First, there was some progress made this year in the legislature. For example, I had a constituent there at the bill signing whose son committed suicide, who was very glad to see the state doing what it can to bring awareness into the process in terms of educators being trained on suicide issues that are unfortunately happening more and more in our state. The frustration is you can identify the student and you can identify a need to intervene, then what? Then what happens to that student as they go forward when we don't have resources in the school district, we don't have resources in rural Iowa communities for that student to get access to anything beyond that very first point of intervention for a long-term plan. When we talk about a children's mental health network, I know Senator Mathis has done a great job of trying to steer the development of that the right way, and we'd like to see that network put together. When we think about, how important it is for children to understand that a mental issue is the same in terms of a need for treatment and help as cutting your finger or suffering a sprain or a broken bone or someone getting sick with cancer, needing maybe that acute care, maybe that long-term care. Maybe it's not anything more than getting you through a short-term issue. Maybe it's something that needs just some help along the way intermittently. Maybe it's something that's a serious problem that is going to need a lot of care and treatment. But we need to understand that it's the same as any other medical issue that the child faces. We don't see a structure there to treat it the same in our schools and in our healthcare system. So I think that is very important. I think the most important thing we can do for mental health in Iowa is get us out of privatized Medicaid. When we have providers getting reimbursed for the things that they do, getting the delays out of the system and those denials out of the system and more regularly reimbursement that allows them to meet their budgets. And when they can meet their budgets, they don't have to struggle with the decision of whether or not they're going to start scaling back services and the things that they provide. And unfortunately, mental health is expensive to provide in a lot of rural communities. It's hard to get a psychiatrist into a rural hospital. There's a shortage of workforce there. And when we see more and more delays, more and more denials, particularly in the chronic end of things, it's kind of both ends of it. It's the most acute cases and the most chronic cases where we see the struggles in this privatized system. We're going to have providers make that decision to say, we're not going to do this anymore. And it's not just mental health, it's also substance abuse. And those two things do go hand in hand. I toured the Jackson Recovery Center in northwest Iowa. A facility that provides a lot of good quality services for people that need someone to help them get through a trying time in their lives. And facilities like that are going to have to scale back services or shut down if something does not change in this system. It's not enough for Governor Reynolds to say mistakes were made in going into private managed care in Medicaid. You have to take action on those mistakes and address them. I, along with Senate Democrats and our one independent, have sponsored getting us out of the MCO contracts and getting a new transition put back in place to start taking care of people. That's going to be a big step in, allowing providers to succeed in our communities. So yes, the Children's Mental Health Network is needed. Getting us out of privatized Medicaid will do a big part of helping provide the structure for doing that as facilities have the reimbursements they need to succeed long term. And then it's just education and getting rid of the stigmas that are associated with mental illnesses and disorders. When children are growing up, they need to know that they can reach out for help at an early age, as opposed to having it ingrained in them that there's something wrong with them if there's a mental illness involved.
Could I tack on a quick follow-up? So as a member of the Hawkeye Board, and we've talked about how effective that program is, and in part that's because that's one of our only children's health programs designed specifically for kids.
Right.
Do you see any strategies to take some of the child-focused emphasis of Hawkeye and apply that to Medicaid? Because as Cheney mentioned, half of our Medicaid members are kids. So
right.
How can we add some pediatric focus to help better serve half of our Medicaid?
I think that is a good opportunity. I think we can learn some lessons from effectively managed programs and apply them. The danger is when you just flip the switch and see how things work out. That's not the good approach. So I think we bring in some of the other folks that have served on the Hawkeye Board with me and others, and bring in people that have had successful experiences in our healthcare system to redesign our approach. Because I hate to say it, but it wasn't all just perfect before we made the switch. It wasn't just a picnic. It had problems and shortfalls when it was purely state managed as well. But certainly we weren't seeing the drastic levels of problems that we're seeing play out right now. One of the things I've proposed on Hawkeye is expanding it with a buy-in program, where we have a lot of families that maybe have access to an affordable, quality single plan with their employer, but you start adding in a spouse and children, it becomes unaffordable very quickly. We could have a buy-in program for Hawkeye and allow a lot of families to kind of reduce some of their internal budget stress and get into a program that does work pretty well and better secure our Hawkeye program in the process as well, so we're not as dependent on CHIP and the federal government as those issues arise maybe in the future. We've got a little more security in that system. So there are things we can be doing. I co-sponsored legislation to do that Hawkeye buy-in program. Senator Peterson filed it, and I was one of the co-sponsors. But those are solutions we can look to.
And I think something that goes hand in hand with health and well-being is the issue of safety and security in our communities and our homes. So I'm going to turn it over to Ann Disher to talk about that topic.
Sure. Well, I think we're all aware of some really high-profile tragedies, right, that have happened with youth adopted out of our foster care system, and I think they've really raised questions around the capacity of our child protective services here in the state. But beyond those high profile cases, obviously we've got thousands of kids in Iowa who have been subject to abuse or neglect, and thousands who are actually in our foster care system right now. We know that what kids need is safety and stability and connections to caring adults and permanency, particularly kids faced on a precipice of maybe aging out of foster care. So we know these are big issues for our foster care system and maybe some areas where we're falling short. So what we would love to know from you is the actions you would take to reduce the number of kids who are subject to abuse and neglect in the first place, and then how do you ensure that youth aging out of the foster care system have a promising future?
Yeah, well, you kind of see these three critical concepts: trust, continuity, and coordination in terms of healthcare, in terms of caseworkers being able to manage caseloads and have relationships with the children they're trying to serve. So, when we see a reduction of 1,300 to 1,500 field staff in DHS, that means the remaining caseworkers are dealing with dramatically higher caseloads. And you're not going to understand the complexities of an individual child situation when you just can't keep up with it. And we've lost many of the public checks in the system for children that have been adopted that can slip off the grid completely, especially those that don't have any intervention with DHS whatsoever. I mean, you're talking about cases where abuse can really be problematic, and those opportunities, unfortunately, for bad actors are at a high point right now. And so, again, it goes back to the budgeting process, right? We're not going to be able to reduce caseloads for caseworkers if we continue to have fewer caseworkers out there working longer hours and potentially not getting paid overtime for the hours they work. What you're going to have are fewer caseworkers that simply reach the point where they cannot stomach being in this system any longer, that they are drowning in their work. And I've talked to social workers and caseworkers before who do this for all the right reasons. They want to help people. And we've put so many of them in a position where they feel like they can't help people the way they should anymore because of the problems and the limitations they have and how they can do their work at this point. And so I'm talking about people that have approached me crying, thinking about, if I leave, what happens to the people that I am trying to improve their situation. But if I stay in here, I can't go to sleep at night. And it's a terrible predicament that we've put far too many people who want to do the right thing for the right reasons in. And so my number one priority gets us into budgeting as a priority and treating the workers that are doing this job with the respect and giving them the resources they need to succeed in those positions. That's the biggest and most important thing we can do in this process. And then we get into trying to bring more sunlight into these situations. We should have regular check-ins to make sure that the welfare of children is being addressed in those students, those young people that are off the grid. We want to make sure that they're getting the wellness checks at a bare minimum that they need.
Well, we have one final topic to talk about today, and I apologize, I am not an expert on this, but our members today that address this issue couldn't be here today, but I'd like to talk about the urgent issue of human trafficking in the state of Iowa.
Yeah.
So in 2017, 40% of the victims reported in human trafficking cases in Iowa involved minors. And according to the National Center for Missing and Exploited Children, factors that make children particularly vulnerable to trafficking include a history of abuse, patterns of running away, and an unstable home life. And perpetrators often target children because they feel they are extremely vulnerable due to their age, and that they are easy to manipulate and control. And they do this through various venues like schools, online and social media, even parks and other public spaces, and foster care and group homes. Yet, despite this being a large issue, it's very it's a very hidden problem, and a lot of people aren't educated to be able to identify that problem occurring even in their own surrounding environment, and to see the warning signs. And so our question for you is, how will you address this issue of human trafficking and ensure that there is broad-based training needed to educate all Iowans, especially those that serve, teach, protect, respond, or utilize our natural resources like public spaces?
Okay. Well, I mean, one of the things that we have to be honest with ourselves about is when I was talking about the things that make Iowa an attractive place economically, one of those makes us an attractive place for sex trafficking, and that is we're the intersection of 80 and 35. We're the crossroads of America here, and it makes it a prime environment for this. And it is a horribly underreported problem. Some of the things that we can do to address it, number one, it is education, is making sure the public understands the things that are happening in our community, whether we're aware of them or not, still are happening underground. Number two, make it so we don't have large segments of our population being pushed underground. And that, I'm talking about our immigrant community. We have a lot of people who are exploited as workers, who feel that they cannot trust the law enforcement process, and that mistrust and distrust is sewn into things like a recent bill that was passed federalizing our local law enforcement and having them do the bidding of the Trump administration on immigration policy in our communities. Well, when you don't trust the police officer that's coming to the scene, you're not going to be forthright about your situation regardless of what's happening to you. Law enforcement has spoken out against that, and we need to do what we can to support our local law enforcement to make our streets safe and secure so they can focus on those things. When you make it harder for someone to trust a law enforcement officer, you make it harder for us to solve cases and protect the public. We need to have resources available for law enforcement and our judicial system. That's a big issue in terms of human trafficking. If we only have 4 or 5 state troopers on the road in our state's highways overnight, that means we have huge segments of our state not being served. And particularly, again, when we're talking about our interstates in this state, we're talking about the truck stops, the public places that can be used as locations for trafficking. Well, when you have one trooper covering a quarter of the state and responding to a car accident, it's hard to have ongoing sex trafficking investigations and operations because those things happen at night. When we look at local law enforcement resources in our communities, when you have a mental health crisis that takes a deputy sheriff and puts that deputy sheriff in a hospital emergency room because we have nowhere to transfer a patient that is a danger to themselves and others in that emergency room, that's a deputy sheriff that comes off the streets that could be investigating these issues that is now stationed in a place where we're just trying to get by for the time being with mental health care. When you look at our courts and our corrections programs and the things that we can do there, again, getting cases turned over, of course, helps with getting convictions and getting some of the bad actors off the streets. But it's also things like the Iowa Juvenile Home that was shut down. This administration starved it of resources to the point that they were able to point at it and say, you know what, this isn't working very well. Well, when you don't have the staffing, when you don't have the resources, there are going to be problems in a setting like that. But now we have judges who want to take someone who is at risk of going down a very dark path for the rest of their lives and getting involved in sex trade and human trafficking situations, to put them in a facility where they have 24/7 supervision. That last chance facility for adolescent at-risk girls was shut down. So, I mean, this is something that we can talk about. We want to support law enforcement, or we just need more cops on the streets. Well, that's part of it, but there are a lot of layers to this problem that can be addressed in some of those more long-term issues. So those are things that I would see as priorities.
Absolutely. Well, I would like to open it up just for if there's any final questions our members have, or Senator Boulton, if you have any questions for any of us in terms of these issues or anything that affects the life of our children and families in the state. So
I could feel a question just forming over there. It's that teacher training, right? Yeah.
All right, so the Child and Family Policy Center is the Iowa grantee for the Annie Casey Foundation's Kids Count initiative. So all about child well-being and data. How do we measure how states are doing for kids? Every year, the Casey Foundation puts out a report that ranks states on child well-being. And Iowa usually looks pretty good. We're 5th, we're 4th, we're 3rd, we're 6th. I think as part of a real effort to try to look at race equity across our child serving systems, Casey has decided to do a very similar process, but took data and broke it down by race and ethnicity, and then compared states. Well, the story for Iowa is actually fairly different. We're used to, and we're like, well, of course we do well. When you break down those indicators of child well-being by race and ethnicity, actually no group looks as good nationally. If we rank 7th for all kids, even for white kids, we rank like 15th, 16th. And our rankings for children of color are particularly problematic, often in the bottom of the pack. And the disparities in Iowa are much greater than they are in most other states. So I would love to hear how you, as governor, would really try to tackle those equity issues and make sure every kid, despite color background, has a good shot at opportunity.
Right. Well, and a lot of it goes back to our economic progress question, right? We can sit here and brag about how our state has a 17-year low in unemployment, but it's not true for our minority communities in this state. And then when you peel back a layer further, wages dramatically lower for particularly African Americans in this state. We got to get rid of those inequities. I introduced an equal pay bill that will start addressing some of that, because we can say all we want that it's illegal to discriminate on wages. The reality is we discriminate on wages in practice over and over again. Looking back at wage histories, so you're preserving a historic inequality there. So how much did you make at your last job, factoring into how much you make at your next job? We can make that an inappropriate and illegal question to ask, so we're not baking into our system the fact that our minorities made less last year, and for their next job will make less this year. Having a vibrant and active civil rights commission process, it's important. I mean, I have someone who's worked as a civil rights attorney and has stood up for people who've had abusive employment practices committed against them. When you ask someone to turn in a civil rights case and they wait for 6 months to get the first response, it takes a lot of courage to step up and say my employer is doing something wrong, that employer that signs my paycheck. It is very difficult to now wait through that process where you've initiated a claim and you're not seeing action taken by the state. We saw legislation last year that would have reduced the amount of time to file a complaint. It takes a lot of courage to file the complaint. It takes some time to get the courage up to do it. And all you're doing when you reduce the complaint period is you're taking valid claims that should be filed and that should be investigated and cutting them off. Not because they're meritless, because you just didn't file it in time. So those are things that we can do in our system to address some of those wage issues up front. And that affects the quality of life from there on. But when you see a giant wage disparity for our minority communities, you're going to see disparities across the board for everything else.
I have a question. Robert Putnam wrote a book, Our Kids, and he talks a lot about the disparity in income and disparity in opportunity.
Yeah.
And I'm very passionate about kids getting in developmental activities, extracurricular activities, both in the school and the community.
Right.
And in Iowa, we have a fee waiver policy that if you're eligible for free reduced lunch or you have economic hardship, you can apply for that fee waiver. Putnam's not really a fan of fee waiver policy. He feels like it's the public school system and we should let all kids do everything. We're also very sensitive to the crisis we're in funding our public schools, so asking them to absorb the cost that is generated by families who can afford to pay for being in activities, that would have a huge impact on the school district's financial situation.
Right.
But how do we resolve this issue? I mean, if you look at data, being involved in these activities is the indicator for our success as
Right.
adults.
Right.
And yet, kids aren't doing it.
Well, and some of it starts with that early elementary process. So in my Senate district, I represent places like Findlay Elementary, where they were targeted for more arts education in their programming. What they found out was, we all this focus and talk about STEM, right? We have to have science, technology, engineering, mathematics. Well, the arts doesn't fit into STEM. But what we saw as a result of getting more arts programming, particularly in early elementary education, you saw better reading scores, you saw better progress on mathematics because students were engaged in the education process, because it became fun, right? It resulted in more parental involvement because parents were coming to see their children perform, and all of a sudden the children are saying, wow, you care about what I'm doing at school. Like, this must be important. And you see students, engage. I may not love math, but maybe I really like singing. And so part of the school day is focused on something that I really enjoy and I'm good at. And so identifying those things that students can excel in early on helps us in later years get them more involved in those activities. Because we can all think of, high school students that the only reason they really go to school every day is to make sure that they can stay qualified to run cross country or play football, right? I mean, that's because that's what they like, and I want to make sure that I don't miss a practice or miss a game. And it's the same thing with choir, it's the same thing with speech. Those students that are turned on to the learning process and turned on to school are much more likely to see themselves driven to succeed in the other academic areas. We haven't mentioned the fact that not only have our schools been underfunded to make that harder and harder, but the latest proposal to cut and then run with the new version of vouchers, education savings accounts. That would take $4,000 per student out of our education funding mechanism, because I don't care what they say, they're going to count those dollars as being spent on education. And just think if we applied that concept elsewhere, that if I have a country club membership, I don't have to pay for parks, right? Because I don't go to the public parks, I go to my private country club. So I just should get a credit for that instead of paying for Lake Aquabi or any other parks around our state. And that's absurd. And how we would do that to our education system, where our public schools don't get to choose who they enroll, they don't get to choose whether or not they provide ELL programming or special needs education. They just have to make it work. And when we see a decline in the resources there, we see a decline in the opportunity to do more arts and extracurricular activities that are the hook for a lot of students to stay engaged in the learning process.
And I'll just close by saying we're just leaving a lot of untapped potential
Right.
that isn't getting applied in ways that are beneficial to the well-being of that child.
Right.
It gets applied, but not necessarily in healthy ways.
And it becomes a 40-year problem, because when that child goes through an education process where they're checking in, checking out, and just doing it because they have to, after age 18, what are they going to do in our workforce? And that's where the problem really should be hitting home to people of underfunding our schools, not providing those affects us long term. So that's kind of the theme of everything we've been talking about here this morning. Is these are not just problems for tomorrow. These are problems that endure into next week, next month, next year, next decade. If we don't get serious about taking care of our children, we are going to see the long-term problems that come into our society, our economy as a result. And we should be a state that leads on these things. We are poised for success here. The fact that we've always prided our public education system as kind of the defining thing in Iowa, that we do this better than almost anywhere in the world, has almost become something where, okay, so we can underfund it and it'll all work out. Well, it can't. we're seeing those problems more and more. So we have to kind of revision what this state should be and could be for the next generation. And that starts with taking care of our kids in our communities. So I appreciate all the work that you guys have done in our discussion here this morning. Is there anything else we need to do?
No, if we could take a picture with you, that would be the last request I have.
No, I'll answer all your questions, but no photos. No, that'd be great. I'd love that.
Well, but just to wrap up, thank you so much for taking your time out to talk with us this morning. I think it is so important that voters hear these issues, in addition to, the things that we hear on ads on TV and things like that, because this is what really affects their day-to-day lives. And like you said, it's all about looking to the future of the state and making sure that we have set ourselves up to be prosperous. And so we look forward to our continuing dialogue with you on these issues as you move forward running to be the next governor. And we're just so thankful that you could be with us today.
Yeah,
so
it was
thank
a great
you,
discussion.
Yeah,
thank you.
Absolutely. Thank you so much. And yes, let's all get a picture if we can, and
I
we'll
can
let
be
you
the
go on.
photographer.
Okay.